Ah, oh.
Tim, what's your computer at? Really? What's it at? Where is that? Sure. Oh, don't what? Dude, I think he did that sugar for a lot. Go get a comfortable illustration.
All right. Wait, do I have a Kahoot on this? No, we haven't finished this one yet. All right, little bit of review from last time. We have some structures. Hold on. Oh, shoot. Nope. Yes. Yeah.
Can you sit with my biology class?
Yeah.
Cool. They're doing test corrections
Okay.
and other stuff. They know how to do that. And then Camille's going to be back and forth answering questions.
Cool.
Awesome. Thank you.
Yeah. Labs. Turn list. Here we go. All right. Went over some structures last time. So we have the iliac crest. We went over the 4 spines, the greater sciatic notch, ischial spine, ischial tubercle, pubic ramus, obturator foramen, pubic symphysis, pubic bone, ischial bone, ilium, acetabulum, and oriented ourselves. Here we have that anterior view. And then on this right-hand side, now we have a internal view. So orienting ourselves to the left of this image, we have anterior and posterior. And then, as always, we have superior and inferior. Okay. So let's start, Tim. This structure that we see that is most kind of almost inferior right here. This is part of what bone that I just highlighted? This pink one right here. Yeah, what bone? Nope, try again. Pubic bone, there you go. And Parker, what is that structure gonna eventually form into when we join it with another side of the pelvis? No, try again. The pink. Pink highlighted.
What is that?
What is it gonna help form? That pink structure right there. It's labeled on the other one.
Oh, yeah.
No. Try again. Pubic symphysis. So then Grant was this circle right here. Obturator foramen, yep. And this structure right here, Andrew, is what?
The purple one.
Yep, purple one. Looking from the inside out. No, so let's split up the bones here real quick. So the pubic bone is going to be here to here. And then approximately right there, right? Yeah. So we have this bone here. It's going to be the what bone, Isabel? Yep. Ischium, yeah. And then this bone here in this light yellow is going to be what bone, Kimmy? Pubic bone. And then Michaela in this light, oh God, light red right here. Pink is what people typically call it. It's going to be the what bone? Ilium. Just going to do this. Okay, so now that we have the three bones, Andrew, can you tell me what that structure is that is right down here? Ischial tuberosity, yes. Ischial tuberosity, all right. And then dark blue right here. Teo, what is that structure that I just highlighted? It's on the ischium. Ischial spine, very good. And then light blue right here. Bree, what is that notch? Greater sciatic notch. Very good. And then next structure right here in green. Yes, Bree. No, we were just going over the bones. We'll get to pubic ramus later. In this image, it isn't super clear, but if we were to label the pubic ramus on this anterior view one right here, it's going to be this right there. Oh, here we go. Zoom in right here. Just inferior to the pubic symphysis, and right here. So Kayla, this right here is going to help form what joint? Very good, sacroiliac joint, or SI joint. And then this right here is the what, Mr. Mark? Very good, iliac crest. And then we can see, let me get my, we're gonna erase right here as well. So we got this one. So this structure right here, I'm highlighting in orange. ROS is the what? PSIS, very good. And then structure just inferior to that, Michaela, is the what? That red one just below the PSIS. There you go, very good. And as I skipped over Kimmy, this pink one right there is the what? And Isabel, this dark blue one I'm highlighting right here is the what? Very good. All right. Let's see here. Did I miss anything? I'll try to frame in. Famous. Tuberosity. No, I don't think so. All right. That's labeled. Any questions on structures on the pelvis? Okay. So what I do want us to compare now are male and female pelvises. And the reason is that they're differently shaped because obviously in females, there is a genetic component to shape your pelvis to be a little bit wider to allow for birth. So on the left-hand side, we have female pelvis. On the right-hand side, we have a male pelvis. We can see differences that I see kind of immediately is we can see a little bit more on that ischial spine right there. And I can also see the sacrum right here. The sacrum has a little bit more curvature inward compared to a male pelvis, right? Whereas the superior view, we only can see like the coccyx at the bottom. Female pelvis, we can see S4, S5 joints where they start to come out. So from that superior view, we can also see that the female pelvis is a little bit more round compared to an oval shape of the male pelvis, or no, vice versa. Male pelvis is more round, female pelvis more oval shape. So then when we look at it from a posterior view, we can start to appreciate one way in which you can essentially go up to a skeleton and figure out if it is a male or female pelvis. The angle right here between the pubic bones is going to be a lot wider in females. So this is female. In females versus males. And you can see that opening. We can see right here. So functionally, there's that sacroiliac joint right there on both of these pelvises. Sacroiliac joint right here. And we can see ischial tuberosities. Let's label these. Ischial tuberosity. We have the ischial spine. Right here is another indicator. And we got those nice big obturator foramen on both female and male pelvises. But really the main difference that you can see very distinctly is that angle between the pubic bones. And I realized I just made a face with the obturator foramen. All right, looking from the front again, we can see that opening, that angle right there between the female and male pelvis. Right, male pelvis is a little bit more triangular shaped, female pelvis a little bit wider. So one of the ways that you can typically do is if you take your two fingers right here for your second and third fingers, make a V with them. That's typically around the spacing that a male pelvis will have. And a female pelvis will have a little bit wider. If you put out your thumb and index finger is around approximation, the angle at which you'll have that difference between a female and male pelvis. All right, so once we put it all together, we have we can see here we can see here what segment of the spine is this going all the way back. Let's see, Tim, these three spinal segments are what? What section of the spine? Lumbar spine. And then we can see our coccyx at the end of our sacrum. So our coccyx is right here. Coccyx. And then we can also appreciate now that the pubic bones are together, we can appreciate this light blue structure is going to be the pubic symphysis. And we can appreciate the sacroiliac joint right here on both sides. And we can also appreciate, lastly, our hip joint right here, where the femur articulates with our pelvis. All right, so a couple joints, and one last one. Structure, big structure right here. That bone is the what, Parker? This orange one right there. Nope, we labeled the coccyx in blue. There you go, sacrum. All right. Any questions on a couple of the joints around the hip? Okay. 30, probably do 10 more minutes. And we'll be done. We can just see again, once again behind here, that sacroiliac joint right here. Joint and hip joint right here on both sides. And the pubic symphysis is covered by the coccyx, so we can't see that one. Okay. Now, moving on to the femur. The femur, here, let's take one of these femurs out. So the femur is the largest bone in your body, also the strongest bone. If someone breaks their femur, it is quite difficult to recover. Sometimes the prognosis isn't very good with some patients. They may never be able to walk again. What is it? Anthropologists have used the distinction between civilization and non-civilization when examining skeletons. They distinguish between civilization by people or by people, older people, having a broken or a healed femur, because when someone has a broken femur, they aren't able to do anything. And so that signifies that the collective group has acknowledged that this person still has value despite their inability to do things. And so they're kind of inherently valued as a member of the community, rather than, just, oh, they're hurt, we just leave them be and die on the side of the road kind of deal. Leave them here in this field. So that has been used to kind of distinguish civilization versus non-civilization. Very big, strong. The hips are the hips, the femur being part of the hip or hip joint, being one of the most important joints for most athletic medicine to evaluate. So specifically in like my clinical practice, something that I see is patients don't have a good amount of hip mobility or have poor hip mobility, or oftentimes one of the largest or most frequent injuries that I see are hip and thigh related. So it can be an area that affects many patients. So first, we're going to start on this left hand side image. This is an anterior view. We can always tell where medial and lateral are based upon the direction of the head of the humerus, or excuse me, head of the femur. My goodness. So head of the femur always points medially. So we have medial and lateral, and then as always, superior and inferior. This is anterior view. We have the head of, that's a little big. We have the head of the femur right here. And then we have, as you might predict, the neck right here. And then we have the greater trochanter, much like how we have, or greater trochanter, much like how we have on the humerus. So it's the greater trochanter right there. And then we also have this line right here between. So if we have a greater trochanter, we have a lesser trochanter. So here, we'll do this one. That little one peeking out, that's going to be the lesser trochanter. And then between the trochanters, we have a line right here on the bone. And that is going to be, Grant, take a stab at what that might be called. Yep, the green. Close. So we have the intertrochanteric line. And we will also see on the posterior side of this image, we also have an intertrochanteric crest. Confusing, yes. Something you gotta deal with. And then we have the shaft. So that's this big part right here. Shaft of the femur. And then as we move distally, we have condyles. So condyles, if you recall, have we had condyles yet? So think of the articulating surface between two bones. These condyles are a little bit easier to see on the posterior side, but on this anterior side, we can begin to see these condyles right here. So those are right there and right there. So the condyles, and so we will have a medial condyle and a lateral condyle. And then in between them, we have a space for our patella. So this is going to be kind of right in here. There's going to be the patellar surface. And then above the condyles, kind of on the lateral, medial and lateral portions of your femur, we have epicondyles. So epi being above the condyles. So those are going to be right here and right here. So this is the medial epicon. Okay. T-Y-L-E, and the lateral epicondyle. All right. So this anterior view of the femur, we have the head, neck, greater and lesser trochanters, intertrochanteric line, shaft, medial and lateral condyles and epicondyles, and patella surface and the shaft of the femur. Any questions on these structures of the femur? All right. We will lab for the rest of class today.